I'm going to start recording. Okay, so we can kind of start where we left off yesterday. And you could
Okay.
start by saying what you see most commonly. We can start there,
Okay.
and how you generally get them to correct it. I guess with
Sure.
their everyday lives and their jobs.
Is there any way I could do the little intro again? I was thinking about it afterwards and it sounded kind of scattered.
Yes. Okay. Well, let's start with then you introducing yourself.
Okay. Hi, my name is Dr. Megan Yim. I'm a chiropractor here in Victoria, and my passion is helping people to, number one, get out of pain, but also my passion is to help people understand how to attain optimal health and function, and how to maintain that long term.
All
That's
right.
it.
That's lovely. Yes, that's such a good goal to have because it's you can get things fixed. I feel like I've gone to a chiropractor before and they fix you and then there's no long-term kind of working on it. You just go and
Mhm.
get something adjusted and then you're good, right? And
Yeah,
so yeah.
exactly. And I see that a lot. If you think about it, there is something in your daily life that you've done that has put you in pain. And that can be something that was acute, like an injury, a sports related injury, or it can be something postural related. For example, a lot of people are sitting at home these days. It could be just postural strain related to that. And yeah, going to the chiropractor is awesome. You feel better afterwards. Tension is relieved. You move a little bit better. However, if you go back to exactly the same thing that put you there in the first place,
Yeah.
obviously it shouldn't be a shock that it comes back.
Yeah.
The key to attaining that long term benefit is adapting your life and changing your habits.
Hmm. And so you would fix the problem that's happening right now, but then do you sit with your clients and kind of coach them afterwards about how we can make it not come back?
Yeah, absolutely. That is the key to my care.
Mhm.
Initially, of course, people are in pain, we deal with the pain. However, after the first couple of visits, when people are in less pain, well, now we have to figure out why they're in pain to begin with. And of course, I go through a detailed history just to get a picture of people's lives. But when you come in and you're in pain, that pain takes over. And so sometimes you kind of lose anything but that pain. So
Yeah.
over the course of a couple of appointments, I'm always checking in like, what have you done this week? Was there anything different in routine? It's always sort of an unfolding story that you have to delve into with patients to pick up the little clues every single time someone comes in. Oh, you spent 3 hours lying on your side, kind of trying to type on the computer. Is that a good idea? Probably not.
Yeah.
So you think out those silly little things that we all do that we don't even really think about,
Mhm.
that really get us into trouble.
And so now that with COVID and everybody's working from home, you probably see a lot of, yeah, like the weird laying down and typing and
Yeah.
sitting on weird places and trying to be comfortable at home.
Yeah.
What main things have you seen or suggested with that kind of problem?
Yeah, absolutely. I'd love to share some, concrete tips with you guys. So I work at two clinics. I work at UVic at Victory Therapeutics in the Student Union building, and I mainly see students there.
Mhm.
This past year has been really, really difficult for students because, obviously everything is online.
Mhm.
Usually in the school year, you have an hour and 20-minute lecture. You've got 10 minutes in between. You get up, you walk to the next classroom. There's some kind of movement. Well, now students are just stuck at home all day, and it's class after class. And what I've heard fairly consistently is that this year, just because everything's been online, there's been more of a push towards online forums, assignments, more stuff that will keep you on the
We'll
computer.
stay, yeah, going forward.
Exactly. Exactly. Very little movement involved. So, one of the big things that I suggest for students in particular is to set a timer in your phone. Every 30 to 45 minutes, it goes off and you move in some way. Now, I'm not talking about necessarily getting up to walk around because obviously, if you're in the middle of a lecture, that's kind of rude.
Yeah.
But it can be just, shifting your position in your chair. It could be standing up for a second. It could be doing a stretch. I actually have a YouTube channel where I post a lot of my rehab exercises, and you guys are all welcome to go and check it out. It's open access. It's nothing is private on there, and there's some really excellent exercises that are postural relief stretches, mobility drills, just generally really good movement to help your body in various ways. And there's obviously exercises for different joints,
Mhm.
but there's a couple in particular that I can maybe list for you that you
Yeah,
can share, that would be particularly applicable to people who are stuck on the computer all day.
definitely. Yeah, I'd love to watch those videos.
Mhm.
And is it just do we just look up Dr. Megan Yim
Yeah.
or
Yeah, exactly. It's just Dr. Megan Yim on YouTube. I've got a channel there that I think there's like something like 40 exercises, and I'm trying to add content relatively frequently. But yeah, there's a great foundation there.
very
But yeah, I also wanted to mention I also work at BackFit, and I get a completely different demographic there.
yeah.
I get a lot of people who have desk jobs, um, and who are now forced to work from home,
Mhm.
safety first, you know. And unfortunately, at the office, there's usually a decent amount of effort put in towards making sure ergonomics are appropriate. So I'm sure lots of you guys have seen the pictures. Good ergonomics are, sitting straight up in your chair, bum is all the way to the back of the chair, elbows are at 90 degrees, your screen is nice and high so that when you look straight ahead, that should be about the middle of your screen. Awesome. However, if you take the most, fit elite level athlete and you sit them in a chair in that perfect posture for 8 hours a day, they're going to be sore.
Yeah.
Our bodies our bodies are not made to just sit in one posture all day, even if it is the most ergonomically appropriate posture.
Yeah, and we get tired throughout the day, so then you start
100%.
slouching and your bum scoots to
Or
the end of the chair.
Yeah,
Yeah.
100%. And, a lot of the people that I see now are telling me they're not even at a good ergonomic setup. They're at the kitchen table.
Mhm.
They're sitting on their couch. They're sitting on a bar stool at the kitchen counter.
Yeah.
So, of course, that slouching is going to happen. So, a couple of great tips for particularly people who are specifically working from home is, when you first go to the office first thing in the morning, you'll generally either drive the car, take the bus, and then you'll walk for a couple of minutes, either into the building, from the bus stop, whatever it is. So, that's a great way to start the day, is to go for a 10-minute walk, come home, go about your work. At the end of the day, you do the same thing. You go for a little walk, mimic that, walk into the car, walk into the bus stop, and then you get home. The two benefits of that is, number one, you're moving your body, minimally, but at least you're moving it.
Yeah.
But also, I've noticed that a lot of people are telling me they're working longer hours
Yeah.
just because, right, the computer's at home, they might as well keep answering emails. I mean, it's sitting
Exactly.
right there. And, that's not necessarily a good thing.
Mm.
So having the kind of bookends of a walk before and a walk after is just another tool to also end your day,
Yeah.
end the work, and just start your at-home time.
That's perfect. Yeah, I know it's hard when I've worked from home. I don't usually work from home, but I have worked from home a couple days during this time. And yeah, you could just continue working because you're you're at home already. You don't need to drive home or go get groceries or whatever on your way home. And so you
Oh,
have nothing there. So you just keep going. So your day is definitely longer. I
yeah.
like that idea.
Yeah, a friend of mine, she was telling me she worked like a 13-hour day last week. Not okay. That's
No,
too long. Not only mentally, but also physically. If you're sitting there
sitting
for
more.
13 hours, oh my goodness. Not good for the body.
No, no. Um, and so what I guess people could either kind of be doing two things right now. Either they're sitting a lot or they might be still at their jobs. I'm thinking like healthcare workers and nurses and doctors and everybody who is working with the pandemic right now. Do you see a lot of those people coming in and having
Yeah,
problems?
I have a lot of nurses who are in my practice, and nursing is always a hard job.
Mhm.
It's always stressful. It's always long hours. There's night shifts. Like that's tough.
Yeah.
But what I have noticed is more recently there's more pain in general. Not just in health workers, but in general. And one of the really interesting things that people don't necessarily always think about is the fact that pain and health are multifactorial. It's not necessarily just a muscle strain. It's not necessarily just a kink in the neck. Well, what has led up to that?
Mhm.
And right now I think we're all in this state of it's been a year of pandemic. I
Yeah.
mean, we're all a little bit more on edge. We're all feeling the effects of that stress. So for health workers in particular, it's stress relief protocols and stress relief and self-care techniques that are so important. And maybe that's not chiropractically related, but it really is.
Mhm.
Because at least the way that I practice, I want to have patients who are healthy in all aspects. It's the wellness that I'm looking for. It's the optimization and the long-term health. And that involves everything.
Yeah.
So some of the things that I suggest for people is, what do they do for fun? What do they do that gives them joy? And, sometimes when we feel like we're busy, there's just not time, take 10 minutes. I had a patient and we kind of chatted for a bit. And I was like, you know what? What is the thing that gives you peace? And it was so simple. For him, it was literally sitting on a park bench drinking a cup of coffee.
Hmm.
That's all.
Yeah.
And, sometimes people need to be reminded, despite the chaos and the obligations and responsibilities, your one responsibility is to take care of yourself.
Yeah.
So make sure that despite everything else, take 10 minutes and do something that gives you peace.
Yeah, go sit somewhere peaceful and have your
Yeah.
coffee or read a book or whatever it is
Mm,
that does that.
totally.
I know I've had a hard time setting aside time, especially when now that the time changed, it's nice because it's actually light out sometimes when I get home and it's light in the morning and it's much
Mhm.
more uplifting. But like I spent this morning, I went to an outdoor fitness class in the park,
Nice.
and then did some gardening, and that's the best. It's so nice. And so I had to like pry myself away. I was like, oh no, I need to shower and then come talk to you. But I actually started doing something that I enjoyed, which was so nice because usually lately it's just get home from work and you make dinner and you sit on the couch and then you go to bed and then you do it all over again.
Yeah,
So it's
absolutely.
lovely. Yeah.
One thing you just mentioned there that is key too is the fitness.
Mhm.
That's one of the things that has really taken a hit because I don't know about everyone else, but I initially put my gym membership on hold just because, I wasn't sure. Like I see a lot of patients and I would never forgive myself if I was a vector for someone getting sick. So
Yeah.
I have been going to the gym and I think a lot of people are finding the same thing is just sedentary activity.
Mhm.
And that is a huge contributing factor to decreases in health and increases in pain. One of the universal prescriptions is for everyone exercise.
Yeah.
If you increase the strength of your body, your pain decreases.
I
Um,
know, and I've been scared to go to the gym as well. I work in a seniors home, and so I wouldn't forgive myself either if I ever brought something in there. And so I haven't been going to the gym. I haven't really been working out, but I found this exercise class that meets at this park. And you just go there and you're outside and you use whatever equipment is on the in the forest pretty much for just hanging out there. And so it was so cool. And so yeah, I'm really glad I found that because it's COVID safe and I feel okay doing it and not that I'm not gonna be at risk. But I also feel so good to start working out. The last couple of weeks have been really nice.
Totally.
Yeah.
Yeah, that's fantastic. That is one recommendation I will give to everyone.
Yeah.
Exercise in some form.
I'm curious what you do you talk to your patients about nutrition or how that affects their body?
Yeah, nutrition is not something that is in my sort of realm of expertise. However, I do acknowledge it is huge,
Yeah.
especially inflammation in relation to pain. If there is systemic inflammation in the body, it basically just makes your nervous system more hypersensitive and more reactive to anything that could be a pain generator. So, the one thing that I will recommend for people is anti inflammatory supplements. So, that is things like high dose fish oils, curcumin, things like cayenne, black pepper, ginger. They're all very anti inflammatory too. And then I do recommend avoiding sugars, processed foods, limiting red meat, and upping things like green leafy vegetables. Those are very, very basics in terms of nutrition. I work with naturopaths, so I'm constantly referring people to go and see a naturopath just to see if there's other dietary changes that they can make to really get better benefit out of the musculoskeletal care that I'm giving as well. Yeah, you're absolutely right. Nutrition is key.
Yeah, it's all joined together.
100%. Everything's connected. Surprise, surprise.
Yes, totally. And I'm curious what's the schooling like to become a chiropractor?
Oh, that's a great question. It's a long haul. So the absolute minimum that you can do to become a chiropractor is you can do 3 years of your undergrad, and as long as you have the required sciences and lab credits, then you can apply to go to chiropractic college after that. There's only a handful of people who did that in my year.
Mhm.
Most people had a degree, usually in kines or health sciences of some sort.
Yeah.
Um, I personally have a degree in psychology and then a master's degree in neuropsych here from UVic. And then the chiropractic education is a 4-year program. The first and second year actually are basic sciences that every healthcare practitioner would have to go through.
Right.
Microbiology, pathology, histology, biochem, anatomy, all that fun
Fun
stuff.
stuff. Yeah.
And then the third year is more chiropractic related. So clinical information, diagnosis, radiology, other advanced imaging. And then our entire last year is spent practicing in a teaching clinic.
Mm,
And I went to school in Toronto. That's the only chiropractic college in Canada. Oh, I shouldn't say that. There's a very small school in Quebec as well.
okay.
But it only graduates, I think, maybe between 20 and 30
Mm,
chiros a year, whereas CMCC in Toronto, it's my grad class was like 180 or something.
yeah.
Yeah, so anyways, the last year we're in a teaching clinic, and that's a really amazing opportunity because number one, we get to learn. We're overseen by a licensed chiropractor who approves all of our clinical decisions. But we are in clinics that offer care for between $0 and $15.
Wow.
So Yeah, so we see a lot of the people who wouldn't be able to afford seeing any kind of manual therapist otherwise. So it's really cool. We get to help people who wouldn't otherwise get help.
That's really nice. Yeah, it's difficult when price can be a barrier, but when something like that, and everybody could do it, and it doesn't matter what your budget is.
Yeah, absolutely.
And so how many years was that total? So just chiropractor school was 4 years, and then you have
So,
your
so
master's.
yeah, minimum post-secondary education that someone can have is 7 years.
7 years. Okay.
I personally have 12.
12. Wow.
Yeah, my brain is worth a lot of money right now.
Do you do anything with the psychology part of your degree right now?
Yeah, that's a great question. I often in chiro school regretted not doing something like kin before chiro because they already have the anatomy, physiology,
Mm.
biochem, etc. And me not really having a background in that, it was hard.
Yeah.
But at the same time, now that I'm out in clinical practice, I use my psych degree every single day.
Good. Yeah.
Yeah, and it's not necessarily in, thinking about the neuropsych part of it, I'm not thinking about, "Oh, frontal lobe, occipital lobe," whatever it is. It's more in understanding people and
Right.
understanding how to communicate in a way that is going to establish rapport, and most importantly, help people make important, healthy changes. So, yeah, the psych degree, it definitely helps.
That's very cool. Yeah, I wouldn't think that it would really be connected, but it's obviously helping you with your
Yeah,
business. So that's great.
absolutely.
All right. Well, what else is there? So how long ago did you graduate from chiropractic school?
Yeah, I graduated June 2019. And so I started in practice August 2019, just before the pandemic started.
Yeah.
A fantastic time to start a practice.
Perfect. And what's your typical work day like? I guess you could have two different kind of work days.
Yeah, so I work at UVic, 3 shifts a week. So it's short shifts. It's usually like about 4 hours, but it's really interesting. I actually work at 3 different clinics, and I see a very different demographic at each clinic, and I kind of appreciate that. I
Mm.
see students at UVic who have done a little bit too much studying, so I help them out, get their bodies moving a little bit better, and make some ergonomic recommendations, give them some exercises to try at the gym. Whereas at my clinic at BackFit, also here in Victoria, it's more people who have chronic pain or who have more complex cases. They've tried a lot of other clinics, a lot of other therapists, and haven't had a whole lot of success. I see that more at BackFit. So
Yeah.
it is more complex. I see a variety of neck pain, low back pain, headaches, hip pain, shoulder pain. I have, tendinopathies. I have plantar fasciitis. Lots of variety.
Yeah.
And then I also work at a clinic up in Nanaimo, just helping my family out. And there I see more, I would say the demographic is typically a little bit older. So I see a lot of osteoarthritis cases and stenosis. But the really interesting thing is that for postural related strain, for chronic pain, for arthritis and stenosis conditions, for every single one of those things, exercise is in the research the most beneficial therapy.
Wow.
So even though there's a lot of variety in terms of the cases and the demographics that I see, it's consistently seen that exercise is the one that wins out.
And that's probably harder as these when you're in pain with arthritis and all of those kinds of things, it's probably the last thing you want to do.
Yeah. Oh, 100%. A lot of my job, and this is where the psych degree comes in.
Yeah.
A lot my job, it comes down to coaching. Of
Yeah.
course, when they're in the clinic, I give them 100% of my effort. We do, stretches, mobilizations. I'll adjust some of my patients. We do all that, and people feel better, but I can't go around, like, following my patients around all day to do that every, like, hour or 2.
Yeah.
So that's why I'm always so insistent that we get some tools, build a toolkit of things that people can do on their own that will alleviate those symptoms.
Mhm.
And, once people understand, once they see the benefit and they feel the relief, then they're kinda like, "Oh, that's what she was talking about. Okay, I guess I can do this." And then they fall off the bandwagon, and then they get back on, and it's always kind of a cycle, but
Yeah.
once you understand that it is possible to feel better, to function better, it's a lot easier to get back there.
And is we talk about people going to the chiropractor to see you or any chiropractor when there's problems, but is there,
Mhm.
do you have clients that just come see you even if they don't really have anything wrong with them at that moment, just as a maintenance kind of
Hmm.
cycle?
Yeah, absolutely. Those are my favorite kind of patients. It's much easier to keep someone healthy than it is to get them out of pain and then keep them healthy from there. So,
Yes.
yeah, I have a lot of patients. And I must say, I have a lot of patients at UVic in particular who are just like, you know what? I kind of think maybe I should take care of my posture a little bit more, should take care of myself. I'm not really in pain, but just want to know what I should do. And I'm like, oh my God, you are the perfect patient, because that's exactly it. The knowledge and the education of what is going to be beneficial and what is going to be detrimental to your body, it's so much easier to get that information when you're young and can implement those changes, or before you get to the point where you can't do anything but deal with your pain. So
Yeah.
yeah, I have a growing number, especially at UVic, of people who are just interested in prevention. But I have a lot of patients who, used to be in a lot of pain, and then afterwards they just come in, once a month, once every couple of months, to just make sure they're still functioning optimally, and to check in with their accountability coach, myself, to make sure that they're actually doing their home care and their preventative exercises.
That's great. Yeah. I know. I think that, well, when I went after a car accident I had 5 years ago, I went, I think, for a few sessions, but then I felt okay. So then I was like, okay, well, I'm not going to go anymore.
Yeah.
But it's probably good just for everyday kind of aches and pains. Sometimes your back hurts, sometimes your neck hurts if you sleep weird, and it'd probably be
Yeah.
good to just go once a month.
Well, it's actually really interesting. Like, I experienced this myself. I finished grad school and I was like, okay, well, what should I do next? And I actually got a job at BackFit as an assistant before I worked there as a chiropractor, and I started getting regular care. So for the first little while, I was adjusted every week, and I wasn't in pain. I played sports regularly. I exercised, but once I started getting care, I was like, "Oh, this is what I could feel like all the time? Wow, I had no idea it could be so much better." So
Yeah.
it's not necessarily just, if you're in pain and you want to stay out of the pain, but it's also just optimizing your function. It's making sure that your body is moving as well as it possibly can.
Mhm. Um, is the one at UVic, is that just part of the student services, or do they pay for that? Or
So, it's a private clinic. It just happens to operate out of the student union building. So I see people who also just live in the neighborhood. I see
okay.
staff, but the benefit of that one is we do direct billing.
Oh,
So the students in particular, it's direct billed to their health insurance. So they only end up having to pay, like, I think, $15 out of pocket. So makes
nice.
the decision pretty easy.
Yeah, yeah, when there's the price barrier isn't there as well for
Mhm.
students, it's hard.
Yeah, for students in particular, it's tough. I
Yeah,
mean, you gotta eat, right?
yeah. You would know, you went to UVic for a long
Mhm,
time.
mhm.
Yeah, well, that's so cool. I'm so glad that we had this chat. I hope it helps other people and makes them more aware that with their new situation, right?
Yeah, yeah, and I would love for you to, share my YouTube channel
Yeah.
and get those exercises out there because, like I said, they're pretty, general exercises. Of course, if you have an injury, you might wanna talk to a professional before trying them,
Yeah.
but if you're just a normal person who's interested in, getting some exercises that'll alleviate some postural strain during the day, there's some great stuff there.
And is there any kind of other website or anywhere that people that are listening can find you as well?
Yeah, so I'm listed on the BackFit clinic website as well as the Victory Therapeutics website. I just have a little profile there, and if you're interested in stopping by to say hi, then you can find me at both of those clinics.
Awesome. Okay, well, I'm excited. I'm gonna go watch your videos for myself and also I'll share them.
Cool.
That's awesome. Well, thanks for being on the podcast, Megan.
Yeah, thanks for chatting. I had a great
Yeah.
time.
Yeah, I'll be in touch closer to when it comes out.
Absolutely. I'll post it on my social.
Awesome. Okay, thank you.
Thank you so much.
Have a good day.
You too.
Bye.
Bye.